Ohio's rural hospitals sit at the center of the Medicaid cut story, and the impacts are sharper, faster, and more destabilizing outside Ohio's metro corridors. The core takeaway: Medicaid cuts don't just reduce coverage, they destabilize the entire rural care ecosystem, from emergency departments to nursing homes to ambulance services. Okay, guys, that is what we're discussing for B. So please join me for discussion B. Give me 1 second, please. The core impact: rural hospitals lose both financial oxygen and clinical capacity. Rural hospitals in Ohio rely on up or Medicaid for up to 60% of their inpatient revenue, a proportion fair a proportion far higher than in Columbus, Cincinnati, or Cleveland. These hospitals serve older adults, people with disabilities, and low income workers who disproportionately depend on Medicaid. When Medicaid dollars shrink, rural facilities feel the shock first because they operate on razor thin margins, have limited commercial insurance to offset losses, and depend heavily on supplemental Medicaid payments to stay afloat. Cuts don't just reduce revenue, they remove the oxygen rural hospitals need to keep beds open, staff employed, and services running. What Medicaid cuts mean for the ground in rural Ohio. Higher risk of hospital closures. Ohio already has over 30 rural hospitals operating at negative margins, and Medicaid cuts accelerate closure risk by shrinking reimbursement for inpatient and outpatient care, reducing supplemental payments or DISH, direct payments, provider taxes, limiting ability to recruit clinicians or maintain specialty services. A rural hospital closure in Ohio typically means 30 to 60 minutes added to emergency travel time. Loss of obstetrics, behavioral health, and surgical services. Immediate economic decline in the surrounding town. Increased out of increase of increased out migration as families leave for communities with reliable health care. Closures don't happen quietly, they reshape the entire country. Emergency departments become fragile. Rural emergency departments are community safety, communities' safety net, and Medicaid cuts weaken them by reducing staffing, nursing, physicians, and techs. Increasing uncompensated care, forcing division of temporary shutdowns, eliminating 24/7 coverage for critical specialties. This is especially dangerous in counties with high rates of stroke, cardiac disease, opioid overdoses, farm related trauma. When ED departments destabilize, mortality rises, especially for time sensitive conditions. Service line reductions hit maternal and behavioral health hardest. When rural hospitals cut services, they start with obstetrics, behavioral health, outpatient surgery, dialysis, chemotherapy. Ohio has already seen multiple rural OB closures, leaving pregnant women traveling 45 to 90 minutes for delivery. Medicaid cuts widen this trend and increase maternal morbidity, especially among women with chronic conditions or limited transportation. Nursing homes and home care agencies destabilize. Rural hospitals depend on nursing homes and home care agencies to discharge patients safely, make Medicaid cuts, reduce nursing home staffing, increase wait lists, slow discharges, increase hospital length of stay. This creates gridlock. Rural hospitals fill up ED departments back up and patients wait longer for care. The entire post acute ecosystem becomes unstable. Workforce shortages worsen. Rural, rural Ohio already faces 40% fewer primary care physicians per capita. Higher high nurse vacancy rates, difficulty recruiting specialists. Medicaid cuts make recruitment nearly impossible because hospitals cannot offer comprehensive salaries, loan repayment incentives, or residency rotations. Workforce shortages become structural rather than uh, cycle. cycle. Ambulance and EMS services become unstable. EMS in rural Ohio is often volunteer based or chronically underfunded. Medicaid cuts reduce reimbursement for ambulance transports. Critical care transfers, community paramedicine. This this leads to slower response times, fewer staffed ambulances, and longer waits for life-saving care. While why rural Ohio is uniquely exposed. Three structural realities make rural Ohio more vulnerable than urban centers. Older populations, higher Medicaid and Medicare dependency, higher poverty rates, fewer commercially insured patients, long travel distances, closures have outsized consequences. In many counties, the rural hospital is the largest employer, the only emergency department, the only maternal unit, the backbone of local economy. When Medicaid cuts hit, the entire community feels it, from schools to small businesses to local governments. The bottom line, Medicaid cuts don't just trim budgets, they threaten the survival of rural hospitals and the stability of the communities they anchor. Ohio's rural health system, already stretched, cuts push it toward a tipping point where closures, services, reductions, and workforce losses become inevitable, irreversible. Okay, guys, that's your beat for now. So, with that being said, Gator Wellness, take care, folks. I'll be back on after dinner.